So I welcome you all to today's session. Myself Rajita, and as you know, we were discussing regarding the fluid electrolyte imbalance for an individual's body. So in this session today, we are going to continue with the same topic of fluid electrolyte imbalance. So in the previous session, we have already learned the basic regarding the fluid imbalance and the management. We have also studied in the last session regarding the sodium and potassium imbalance in patient body. So here in this session today, we are going to learn about few more electrolyte imbalance. Now we are going to study first regarding the calcium imbalance. So as we know, calcium is a very important substance or elements that is present in an individual body. So calcium is necessary for many metabolic processes to continue in an individual's body. And we are going to see the calcium will be acting as a major substance in the bone and teeth formation. There are some other functions too, which we are going to discuss now. The other functions includes first is blood clotting. So you have to remember calcium plays a very important role in the initiation of the blood clotting if there is any traumatic injury is present in individual's body. The next major function of calcium is the transmission of the nerve impulses. So as we have learned, the nerve impulses or electrical impulses which is generated from the nerve cells will be traveling through the different nerve cells, right? And will be helping to maintenance of the activity of a particular individual. So we are going to see the calcium will be working as a transporter or for those electrical impulses which are generated and transmitted between two nerve cells. The third most important function of calcium is muscle contraction. So whenever we are going to study regarding the process of muscle contraction, we are going to see before initiation of the muscle contraction, there should be presence of calcium, which will be also acting as a very important substance to initiate a muscle contraction so that an individual can perform some activity on their own self. So there are a few more main functions of calcium. It also includes the maintenance of myocardial contraction. So we will be learning it in cardiovascular system that heart is having three major layer as we know, right? So the middle layer, which is the muscle layer of the heart, will be almost always having a very important function, which will be maintaining the contraction and relaxation of the heart in order to maintain the blood circulation throughout the body. Calcium here plays a very important role in the muscle contraction even inside the heart. So these are few more important functions which calcium will be having inside individual or human body. Now we will be learning about the calcium imbalance. Here also, we are going to learn two types of imbalance. First one, we will be seeing where the calcium is increased in amount compared to the normal level. Whereas in the second condition, we are going to see the calcium will be having deficiency in the body. Now, both of the condition, whether the calcium is increased or decreased, we are going to see our client will be suffering from various clinical manifestations, and disease can be developed because of hyperkalemia or hypokalemia. So even we are going to see in this two condition of hypercalcemia and hypocalcemia, or where the calcium level is increased in human body compared to the normal level, or whether there is deficiency of it, both of the conditions will be generating some condition or some clinical manifestations or disease condition. So let us discuss now regarding the two type of imbalance of calcium and their effect and the basic management of it. So first we are going to learn about hypercalcemia. So as the term itself is suggesting, when the calcium level is increased in individual body, we are going to term this condition as hypercalcemia. Now, when the calcium level is more than 10.2 milligram per deciliter in the blood circulation, we are terming the condition as hypercalcemia for our client. So, as like previous, we are going to learn about the causes. What are the factors or etiological factors can be promoting the development of hypercalcemia in an individual's body? Let us study here. So first causes which will be often like this conditions will be often causing increased the total calcium level in the blood circulation. The disease process or the pathological process which will be often increasing the total calcium level in an individual's body include the condition known as myeloma. So in this condition of myeloma, if a person suffering from myeloma, we are going to often see they will be more likely to suffer from hypercalcemia. The next condition is malignancy with bone metastasis. So as we have learned, the major component of bone is calcium. So if there is presence of metastasis, definitely we are going to see there will be degeneration of the bone in individual's body, which will be ultimately producing or segregating huge amount of calcium in the blood circulation. And ultimately, a person often with a bone metastasis will be present with the condition of hypercalcemia. So, the next common conditions which will be often related to the development of hypercalcemia is prolonged immobilization. So here we are going to see that if a particular client or individual is having prolonged immobilization due to any fracture or due to any neurological deficient problem, if it is causing a immobilization of the body parts, we are going to see the person is more likely to suffer from hypercalcemia. Now, the next common conditions which will be often increasing the calcium level in the blood circulation includes hyperparathyroidism. So, in bone metabolism, when we are going to study it, we are going to see the calcium absorption and reabsorption will be basically controlled by parathyroid hormones. So, we are going to see if there is hyperparathyroidism present for a particular individual, the reabsorption of the calcium will be disturbed and more amount of calcium will be present in the blood circulation because the bone are not able to use those calciums for their metabolism. That is when we are going to see if a client is present with hyperparathyroidism, they will be often showing the clinical manifestations associated with hypercalcemia. The next condition is vitamin D overdosage. Now, generally, we do not provide any vitamin D supplementations. Now, if a client is provided with it and if there is any chances of the overdosage of the vitamin D, we are going to see there is or there will be a high chances of the development of hypercalcemia for the particular individual. The next condition is the usage of thiazide diuretics. So if a client is suffering from a disease condition where they are receiving the treatment of thiazide diuretics for a prolonged time, the person will be definitely having a higher chances of the development of hypercalcemia. In case of milk alkali syndrome also, a person can often show the manifestations related to hypercalcemia. The next conditions we will be studying This particular condition always will be increasing the ionized calcium in blood circulation. The condition is acidosis. So whether it is a metabolic acidosis or respiratory, if there is presence for a acidosis for a prolonged time in an individual's body, we are going to see the person is more likely to suffer from hypercalcemia. So next, as we have studied here, the probable etiological factor, or we can say the common etiological factor related to the development of hypercalcemia, now we should learn about the clinical manifestations. So often a person with hypercalcemia will be present with lethargy and weakness. So as we have learned that the muscle contractions will be depending on the presence of calcium. So as there is alteration of it, nerve impulses also will be getting altered, and transmission of the nerve impulse or muscle contractions will be getting impaired. That is the reason why the person may show the feature or clinical manifestations of lethargy and weaknesses often associated with hypercalcemia. Other clinical manifestations which are very commonly found among the patient is decreased reflexes. So I hope you are understanding, as the muscle contractions will be impaired here, we are going to see there will be a decreased amount of muscle reflexes. Even there can be decreased memory for the client. Now, if it is affecting the cerebrovascular circulations and activity, we are going to see a client will be manifesting impaired memory too associated with hypercalcemia. Other psychological clinical manifestations for hypercalcemia includes confusion, personality changes or sudden changes in the personality, in psychosis. Now these are can be caused because of the acute calcium increase in the body, or it can be even associated with the underlying conditions which is basically regulated by the parathyroid hormone. The next comes is anorexia. Now it is a very common and significant feature for an individual who is suffering from hypercalcemia. Anorexia or loss of appetite often will be complained in a very primary stage of hypercalcemia by a client. Nausea, vomiting is very common symptoms. Even a client will be often complain regarding the presence of polyuria or increase frequency and urgency of the urine or urination. Next, we are going to see because of polyuria, a person with hypercalcemia almost always will be having the complaint or manifestations associated with dehydration. Bone pain or painful extremities, as well as joints, even fractures in the bones, are very common features in case of hypercalcemia, as because the bone will be losing the calcium and the calcium is getting increased in the blood circulation. So definitely the bone here will be fragile for an individual. That is the reason increased bone pain or fracture is very common manifestations among the client. Nephrolithiasis is almost always found with a person who is suffering from hypercalcemia. Now, a person even may go for stupor or comatose stage in case of a severe hypercalcemia, or if it is not managed at earliest. Next, we are going to see some significant changes of or with associated with the hypercalcemia. There is changes into the electrocardiograph. Now, if a person is present in a clinical setup with the suspected clinical manifestations, definitely a 12-lead ECG or electrocardiograph will be administered for the client. Now, there we are going to see very prominent changes associated with hypercalcemia. Now, this changes includes shortened ST segment. The next change often will be present is the shortened QT interval. Ventricular dysarrhythmias will be often associated with hypercalcemia. Even there can be presence of increased digitalis effect over the electrocardiograph. So as we have learned the basic etiological factors and probable clinical manifestations, or common etiological factors and clinical manifestations which will be often associated with hypercalcemia. Now we should learn about the basic treatment modalities and nursing responsibilities and implementation to manage the client with hypercalcemia. The first and foremost, you need to remember, once a client is present with hypercalcemia, we should learn about the probable etiological factor which is causing the development of hypercalcemia for our client. Treatment of the underlying disease condition plays here a very vital role to manage the client. Now, the basic treatment which will be directed to managing the condition of hypercalcemia will be including often administrations of the loop diuretics. Now, administration of loop diuretics for a client with hypercalcemia here plays a very important role because it will be promoting the urinary excretion of calcium from the body. That is how a client can be managed with hypercalcemia at initial stage. Hydrating the patient with isotonic saline infusion through IV or intravenous administration plays here a very important role. Next, we are going to see it is advised the client with hypercalcemia should drink 3000 to 4000 ml of fluid daily to promote the renal excretion until and unless there is any contraindication for a fluid intake. Often the client and the caregiver will be taught regarding the diet which is consisting of very less amount of calcium. Often it is suggested to the client to increase weight bearing activity which will be ultimately enhancing the bone mineralization. So depending on the client's condition, it is to be suggested to perform activities or weight bearing activities if possible to promote the bone mineralization. So in this case, by this particular method, we are going to see that the client's bone will be increasing its mineralization so that they will be trying to use the excessive amount of calcium that is present in the circulation. So that is how the calcium level in the blood can be reduced by increasing the bone mineralization. Now, if the hypercalcemia is related with some underlying condition of malignancy, we are going to see the bisphosphonates agent almost always will be administered or will be prescribed by a physician. So adherence to the regimen and administrations of these medications often will be treating the condition of hypercalcemia for our client. So I hope till you are completely understood the concept of hypercalcemia. Next, we will move on to the discussion of hypocalcemia. So I hope the term itself is suggesting here we are going to see the calcium will be present in a deficient amount in an individual's body, basically into the blood circulation. We're going to see the presence of calcium here will be having an amount of less than 8.6 milligram per deciliter. So if a client is present with less than 8.6 milligram per deciliter amount of calcium for their body, definitely they are considered to have hypocalcemia. Now we are going to learn about what can be the etiological factor related to hypocalcemia. So we are going to see here there are certain disease condition which will be often decreasing the total amount of calcium in an individual's body. So the first condition is the chronic kidney disease. Chronic kidney disease often will be causing decreased amount of calcium in the body for an individual. Now, definitely a client with a history of chronic kidney disease will be having a very high chances of the development of hypocalcemia. Elevated phosphorus often will be causing hypocalcemia for our client. The next cause, which is very common cause related to the development of this condition of hypocalcemia, is the primary hypoparathyroidism. So, in case of primary hypoparathyroidism, we are going to see the absorption of calcium into the bone will be increased. That is the reason why we are going to see in the circulation the level of the calcium will be decreased or depleted compared to the normal level, and the person will be developed with certain clinical manifestation. Vitamin D deficiency and magnesium deficiency almost always will be associated with the development of the condition of hypocalcemia for clients. Acute pancreatitis often will be inducing the chances of development of hypocalcemia. We're going to see a huge usage of loop diuretics often will be causing the hypocalcemia. So you just need to relate and study so that you can remember the causes well, because we have already studied that loop diuretics it will be used in the treatment of hypercalcemia. So I hope you got the concept that if we are using the loop diuretics, it will be reducing the calcium overload in the body, or it will be excreting the calcium through the urine. So if a person is having a prolonged and overdosage of loop diuretics, they're definitely going to have a high risk for the development of hypocalcemia. Chronic alcoholism often will be causing hypocalcemia for a client. The other condition is diarrhea. So, if a client is suffering from a severe diarrhea, definitely we are going to see along with the loose stool, they will be losing adequate amount of fluid and electrolytes from the body. So, calcium is one among them which will be lost from the body, and that is the reason in case of severe diarrhea our client will be suffering or will be developed with the clinical manifestations associated with hypocalcemia. Decreased serum albumin. Now, this also will be directly affecting the calcium level in the body, and which will be ultimately can cause the development of hypocalcemia for a patient. Next, we are going to read about certain conditions which will be decreasing the ionized calcium in the body. So, the conditions include alkalosis as well as excess administration or excess consumption of citrate food. So this both condition of alkalosis and excessive consumption of citrate food often will be causing reduction in the calcium level in our body. So that is also a reason why a person can develop with hypocalcemia. Now we are going to learn here the clinical manifestations associated with the hypocalcemia. So the first and very common clinical manifestations is easy agitability. So a person will be showing agitation so frequently associated with the presence of hypocalcemia. Depression and anxiety is a very common feature of hypocalcemia. A person may go for a sudden personality change, even they will be present or they can be present with acute confusion. Other than this psychological changes, we are going to see a person can complain regarding the numbness and the tingling sensation over the extremities. A person often with hypocalcemia will be showing hyperreflexia, and there will be presence of muscle cramps even associated with this condition. Now, we're going to learn about certain very specific sign that will be almost always will be associated with hypocalcemia. Now, these signs will be indicating that the person have developed with a condition of tetany. So often a person will be showing the symptoms associated of tetany associated with hypocalcemia. The main feature which will be often found on physical examination, the sign is named as Chevostek sign. So Chevostek sign is basically a condition where we will be the seeing the contractions of the facial muscle of a person who is suffering from hypocalcemia. What actually happens here in response to the tapping over the facial nerve in front of the ear, basically, if we are doing it, if we are performing the tapping over the ear in that area of the facial muscles of the particular individual, we are going to see, if we are tapping it, the person will be having abnormal muscular contractions over facial muscle, and that is what we are going to call it as Chvostek sign. Now, it is a very prominent sign that the person is developed with hypocalcemia. The next sign is known as Chasseur sign. So basically, it is refers to a carpal spasm which will be often induced by a blood pressure cuff on them. So we are going to see this two sign of Chvostek sign and Trousseau signs are very common feature for a client who is suffering from hypocalcemia. Next, we are going to see the client often will be present with the various signs, as I mentioned, associated with tetany. A person can even have abnormal muscular cramping over the extremities into the facial muscles. Now, there can be development, even severe condition, where a client will be present with laryngeal spasm. A client even can present with the feature or manifestation of seizure in case of hypocalcemia. Other manifestation, depending on the muscular contraction, where it is occurring and where it is affecting the individual, we are going to see a person even can present with the manifestations like laryngeal stridor, dysphagia, numbness and tingling around the mouth, and basically to the extremities. That includes upper and lower extremities. So these are the very common feature which will be present for a client with hypocalcemia. Now we are going to learn about the nursing implementations or basic treatment modalities which will be followed for a client who is suffering from hypocalcemia. So first, we will be identifying very common problems in all among the patient who are suffering from hypocalcemia. Let us study regarding the common problems associated with the condition of hypocalcemia for an individual first. We're going to see a client will be often complain regarding the presence of acute pain related to abnormal muscle contraction. The next common problem which will be seen among the client is ineffective breathing pattern. Now, you need to understand, in a severe condition of hypocalcemia, often a client will be complaining regarding ineffective breathing pattern. It's because of the presence of laryngospasm. Now, the next condition or the next problem, which is very commonly seen among a client with hypocalcemia, includes high risk for further electrolyte imbalance. Even there will be having or they will be having a high risk of getting injury for the client with hypocalcemia. As the client will be having abnormal muscular contraction, they won't be able to maintain the gait. Even they will be able or they will be failed to perform their daily activity of living. Even sometimes you're going to see the client can be in a stuporous stage, or maybe they will be suffering from seizure episodes frequently. There is a reason with the client with hypocalcemia, often there will be high risk of injury for them. The potential complication we almost always includes the development of fracture or respiratory arrest for a client who is suffering from a severe hypocalcemia. So that is the reason this particular two complication should be prevented for a client by initiating a very early management. Now, the primary goal of hypocalcemia is to treat the underlying condition. Now, you need to remember, almost always the hypocalcemia will be causing because of some underlying disease or pathological condition. Solving the particular disease condition will be definitely helping the individual to prevent with the development of hypocalcemia. Now, if there is a client who is present with already severe manifestations, we will be providing some acute intervention in order to manage the complications or symptoms associated with hypocalcemia. Now, the acute interventions includes the intravenous administration of calcium. So this will be definitely helping an individual to come up with a better health or a better recovery from the condition of hypocalcemia. The client would be almost always suggested to go for a vitamin D supplementation associated with a diet which is high or rich in calcium. Now, this often will be suggested to those clients who are under risk of the development of hypocalcemia and who are already having minimal sign and symptoms associated with this condition. Oral calcium supplementations of calcium often will be suggested for a client with mild to moderate sign and symptoms associated with hypocalcemia initially. Now, almost always a client who are developed with severe conditions, we're going to administer certain measure to promote the carbon dioxide retention in the body. We're going to see breathing in a paper bag would be helping. Even sedation to the client would be given in severe extent where control of the muscle spasm would be done by this particular administration of sedation to the client. Treating the pain which is associated with abnormal muscle contraction and anxiety of the client should be done to reduce hyperventilation, which will be often associated with respiratory alkalosis and further can deteriorate the condition of hypocalcemia. So that is the reason why a patient with hypocalcemia often will be provided with a very calm environment, as well as they should provide all the information regarding the treatment procedure, the planning of the treatment and the expected outcome to manage the anxiety. Treating the pain with analgesics often will be helping the client for the prevention of the development of hyperventilation. Patients who are going for any neck or thyroid surgery often should be kept on a continuous monitoring to find out any alteration in the vital signs and hemodynamic stability or any alteration into the sign and symptoms which is basically suggested that the client has developed with hypocalcemia. Remember, the neck and thyroid surgery contain a high risk in the injury to the parathyroid glands. That is the reason why a client should be monitored in the hospital setup or in the clinical setup for a prolonged duration and at a regular interval and in a continuous manner to prevent the development of hypocalcemia. So I hope till now you got the complete idea regarding the calcium imbalance in an individual's body. What can be the causes, what can be the effect of it, or clinical manifestations associated with it. Even we have seen the basic treatment or management modalities, what will be used generally to manage the client with hypercalcemia, even hypocalcemia. So thank you so much for attending this session. We will be continuing regarding the discussion of the other electrolyte imbalance and their management in the next session. Stay tuned. Thank you.